Hi there! Welcome to the Reigning Nutrients, a podcast where we discuss and examine the different health disorders. Health is an essential thing that keeps the body to function smoothly. So, if you are experiencing any discomfort, it is important to take action and schedule a doctor appointment as soon as you can. With this, in today's episode, we'll take a closer look at your symptoms and I will help you understand what your body might be trying to say and ask. So, if you have any health concerns, send me a message and I will guide you. Let us now read our first message sender. At first, I was just feeling muscle pain, nothing too specific. But as the days went by, I realized it was more serious. I started struggling to walk, had trouble getting up the stairs, and even simple things like reaching for objects became challenging. I get tired easily with any physical activity, and I'm also having difficulty breathing when lying down. I'm only in my 30s and I don't know what's going on. Thank you for sending this in. Muscle weakness and struggling to breathe may be caused by a lot of conditions. However, one condition that can present in the same way, especially when symptoms begin in adolescence or adulthood, is the condition called late-onset Pompe disease. This condition occurs when the body has low levels of an enzyme called acid alpha-glucosidase. It is an enzyme that helps break down every glycogen intake in our body. If glycogen or sugar is not properly broken down in our body, it can build up within our muscle cells and tissues. And since our muscle cells only have a limited space, the muscle will continue to stretch, which causes for you to experience any body pain and muscle weakening. Let us now read our second message sender. Hello, I just noticed that my nephew's growth seems unusual. Her stomach and right leg look swollen, while the rest of his body is thin. She has a bulging eyes and her skin also shows noticeable areas of depigmentation. Her appetite is also poor. Could this be a factor? Well, those symptoms may be the result of low proteins in the body, which leads to a disease we call kwashiorkor. When the body is not getting enough protein, it causes many changes in the body. The swelling of the feet happens due to the low albumin levels, which causes the fluid to accumulate or build up in the interstitial or skin and the intercellular spaces. The enlarged abdomen is also linked to reduced levels of lipoproteins. It prevents the transports of fats and cholesterol from the liver to other body tissues, causing for your nephew to experience swelling in the stomach and in her leg. Let us now read our third message sender. Hello, recently I've been experiencing severe stomach pain. I also experience frequent bowel movements, even shortly after using the bathroom. And sometimes, there is a blood present. I'm also dealing with mouth sores. What could this be? Is it related to diarrhea? Hello, your symptoms are similar to diarrhea, but there are still differences. Diarrhea produces watery and mucus-filled stools, while yours has blood. The presence of blood indicates a serious problem in your digestive tract, and this condition is similar to what we call the Crohn's disease. This disease is an inflammatory bowel disease that occurs when the immune system overacts to normal gut bacteria. This abnormal immune response leads to the immune cells to release more pro-inflammatory cytokines, which triggers the inflammation. Once the persistent inflammation occurs in the gastrointestinal tract, it affects the thickness of the intestinal wall and other internal damage, causing fewer nutrients to be absorbed and stomach pain to experience. With this, it is important to have your stools checked by a doctor and have a colonoscopy and a biopsy. Let us now read our fourth message sender. Hello, recently I have been having difficulty swallowing and breathing due to a feeling of tightness or fullness in my throat. I have also noticed that seems to be a hard lump forming in my throat that used to be small but has gradually gotten bigger. Well, the noticeable bulge in your neck may be your thyroid gland, and you might be experiencing a condition called goiter. Your thyroid gland can expand beyond its normal size when they are overworked and they're trying to compensate for something in our body. Our thyroid gland is responsible for producing T3 and T4 hormones. And in order to do that, they need iodine to function properly. However, when the body has low iodine intake, it affects the thyroid gland in producing hormones, causing the pituitary to release more and more thyroid-stimulating hormones, or which we call the thyrotropin. With this, it overworks the thyroid, making the gland grow bigger. Well, several environmental factors also contribute to having this condition, so it is important to still have your thyroid function checked by a doctor. Let us now read our fifth message sender. Hi, I am reaching out because I'm really worried about my blood sugar levels. Lately, my blood sugar levels keep swinging up and down, sometimes extremely high, then suddenly dropping way too low, even though I do it properly. Well, those unpredictable changes of the blood sugar levels can be seen in having a condition which we call brittle diabetes. This type of diabetes is rare but high risk for someone who already has type 1 diabetes. But with frequent medication or checkups, it can be monitored. Our glucose intake can be controlled with insulin. It monitors the glucose level through binding to cell receptors and signaling our cells to absorb the glucose or sugar in the body and use it for future energy. However, if the body does not know how to use this insulin or does not produce enough insulin, it really affects the sugar level. With this, it is important to still consult your doctor and have your insulin absorption or medication. And that wraps up today's episode of Raining Nutrients. Always remember that whatever illnesses you are experiencing, do not ignore it. These are clues given by our body that we need to understand and pay attention to in order to take action. Our body is truly a mystery. So many things can happen inside it without us even noticing. That's why it is important to check up on what proteins, lipids, carbohydrates, or mineral deficiencies or disorders are affecting the body to prevent them early.